Hello everyone, this is Nurse Jem and today I'm going to show you my OSCE preparation. Okay, so for this procedure, I will just sit beside to the patient. But first, I have to check the scene safety. So I will make sure that there will be no wires and water spillages. I will provide privacy to the patient, and then I will start my hand hygiene. So good morning, my name is Jamelyn Clabaton, and I will be your nurse for today. To confirm that I am with the correct patient, may I know your name and date of birth, please? So can I confirm that with your wristband? So your name is Meadows Marcia, and your date of birth is 28 March 1947. Your hospital number is 462-646-2073, and it's the same with my document, so I confirm that I am with the correct patient. So can I call you Marcia? Okay, Marcia, are you comfortable right now? Do you need to change your position? Okay, so you don't need, you're comfortable. And do you have any pain? Okay, so you don't have any pain right now. Okay, Marcia, so are you allergic to any food, medicine, adhesive, or latex? Okay, so you are allergic to latex. So can I check if you have any wristband on it? Okay, so you don't have any wristband for your allergy or the red wristband, but it is written here in your document that you are allergic to latex. And may I know what are the allergic reaction you might have if you are exposed to latex or to the product with latex? Okay, so you will have rashes all over the body or to the exposed area. Okay, so Marcia, I will give you a wristband, a red wristband for your allergy, so that I will be reminded that you have allergy, and also my colleague will know that you are allergic to something, especially to the latex. So that we will avoid a latex gloves, and we will use a non-allergenic gloves for the procedure that we might do to you. Okay, so I am here because I'm gonna take your urine sample on your catheter. So is it all right? Is it okay with you? Okay, so don't you worry, Marcia, because this procedure is painless. I will just need the port of your catheter to take a 10 ml urine sample, and I will not do any harm or expose you, so I will still provide privacy with you, and I assure you that the procedure is painless. Okay, so is it all right with you to take a sample in your urinary catheter? All right, so I will just give you your call bell for any concerns, or if you need any help, just press the buzzer and I will come right away. Okay, so for the meantime, I'm gonna prepare the things that I need for the procedure. So I will do my hand hygiene before I exit the room of the patient. So I'm gonna prepare now the so I'm gonna prepare now the things that I need for the urine sample, or CSU, catheter sample urine. So I'm gonna do my hand hygiene. I'm gonna wear my apron. And then my gloves. Also, I will make sure that this tray is been cleansed with soap and water uh, within this day or within 24 hours. So I will just clean this one with cleanil wipes, and I will make sure that the packaging of the cleanil wipes is dry and intact and up-to-date expiration. So I'm gonna take one wipe. So I'm gonna clean it from farthest to nearest for 30 seconds and let it dry for 30 seconds as well. So my tray is ready to use. Okay, so I'm gonna remove my gloves and apron and dispose it to the chemical waste bin. So I'm gonna prepare the things that I need. So I'm gonna need a 10 ml syringe. My syringe is dry and intact, and the expiration date is 2026-09. So I'm happy to use this syringe. Also, I'm gonna need a 2 alcohol swab. It is written here 2% chlorhexidine and 70% alcohol skin wipe. This is dry and intact, so I am happy to use this alcohol swab. So apart from this, I need a urine bottle. I have to make sure that the urine bottle is closed, so it is sealed, and if there is any expiration date, the expiration date should be up to date. So I'm gonna make sure that I will write the name of the patient, and other details, especially the NHS number or the hospital number of the patient. Okay, so also the label of the test. Okay, so I'm gonna keep it with my tray. So now I am ready to go to the bedside of patient. I will do my hand hygiene. Okay, so I'm gonna wear my apron. I'm gonna wear my gloves. And I will go to the bedside of patient. Okay, so Marcia, I'm back. I bring the equipments that I need prior to take your urine sample. Okay, so are you ready to proceed the procedure? Okay, so Marcia, I have also with me the Inco sheet. So I'm gonna put this one underneath of your port of the catheter, so that to avoid any spilling or soiling the linen. Okay, so I'm just gonna expose you a little, just right to see the port of the urinary catheter. Okay, so I'm gonna place this Inco sheet underneath the port. Okay, so now I am ready. Don't you worry, this is a painless procedure, so you will not feel any pain. So I'm gonna clamp the tube. It's just distal near to the port. I'm gonna clamp it now, and then I am ready to clean your port. But before that, I'm gonna open the syringe halfway so that it will be easier for me to take the syringe. Also, I'm gonna open halfway the bottle so that it will be easier for me to transfer the urine sample. Alright, so I'm gonna take an alcohol swab, an alcohol swab. So first, I'm gonna open the first. I'm gonna clean the port. So I'm gonna clean it for 30 seconds and let it dry for 30 seconds. I'm gonna throw this to the clinical waste bin. So for the meantime, I'm gonna keep here. And I should not touch the port, also the tip of my syringe. So I'm gonna take my syringe. I'm gonna introduce this one to the port and take 10 ml of your urine. Alright, so directly I will put this one to the urinary or urine bottle. So I'm gonna open your urine bottle and then keep this one or transfer this urine sample. This syringe I'm gonna throw directly to the clinical waste bin. I'm gonna close the urine sample, and then I will clean again using the new one. So I'm gonna clean the port for 30 seconds and let it dry. I will unclamp the tube. Then, Marcia, I am done with the procedure. I will just clean your bedside. Okay. So I'm gonna throw this one to the clinical waste bin. I'm gonna cover you properly. So for the sample, your urine is clear with a straw color, so it means that you are producing a good urine. So anyway, I put a label already for this. I'm just gonna need the form to fill, and when I am ready I will send it right away, and if not, I will keep this sample to the refrigerator for 4 hours. So if I fail to send your sample for 4 hours, I might need a sample again. So but I will try my best to send it right away. Okay, so after I send the urine sample with the form, I'm gonna clean my tray and so that I can use it for the next patient or for the future use. Okay, so I'm gonna remove now my gloves and my apron, and I will throw it to the clinical waste bin. So Marcia, do you have any concern? Okay, so you don't have any concern, and I will just cover you properly, and this is your call bell. For any concern or for any help that you need, just press the buzzer and I will come right away. Also, I'm gonna keep your bed to the lowest level and raise your side rails for your safety. Also, I will open your curtain so that you will see the outside, and I will see you also from the distance. And then for additional, I would just like to encourage you to increase your hydration or fluid intake. I keep you a bottle of water here so that you can drink a water in your bedside. And then I would like to remind you that to avoid tagging your urinary catheter, so that to avoid any trauma. Alright, so I will do my final hand hygiene. Thank you for your time and your cooperation, and have a nice day. Done.